Hello and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold Learning, we are getting ready for our GOLD Obstetrics Online Conference of 2020. The conference will start November 9th. That's really around the corner here. And with me here today is one of our speakers from the conference, Dr. Angela Jones. Welcome, Dr. Jones.
Thank you so much. It's a pleasure to be here.
Oh, it is lovely to have you here today. So tell our listeners a little bit, first of all, where in the world are you? Because we have an international audience. And then tell us a little bit about yourself and your background.
Okay, I am currently in Ocean, New Jersey. So I'm on the East Coast of the United States. I'm originally a Midwesterner. I am from Cincinnati, Ohio. And I have been practicing obstetrics and gynecology for about, 15, 16 years. So I've been doing this for a long time. I'm a bit of a non-traditionalist with regards to my approach to medicine. I try to be as laid back and approachable as possible. I very rarely wear my white coat in the office as I find it to be a bit off-putting. I sometimes find that white coats create barriers between clinicians and patients. So most of the time, and as you see me today, I've got on a casual sweater. I actually have on jeans underneath and some fabulous shoes, and that is what I typically wear in the office. You know, so pretty low key. I play guitar. I enjoy cooking and baking with my mini. I have an 11-year-old daughter who is the apple of my eye. We are animal lovers. We have 2 dogs. I have a black lab named Franklin and a kind of like a I have a dog named Snickers that we recently rescued from the Humane Society, and he is just a love. And I'm just very active. My main, kind of impetus, and one of the reasons that I really love being an OBGYN is I'm all about women's health, empowering women through knowledge. And so one of the key ways that I like to do that is, I have a weekly blog post that I put out. It usually comes out on Wednesdays. I do a podcast that is all over the place. It's on Spotify, it's on iTunes, it's on iHeart. And I also have a YouTube channel. I'm all over the place on social media. And again, the whole premise behind all of this is just to make, information more readily understandable and digestible.
And accessible too.
Yes.
So when we try to find you there, we just search for your name, Dr. Angela Jones, or does
Actually,
your
what
podcast?
we'll do is we'll do Ask Dr. Angela,
Ask Dr. Angela.
AskDrAngela. Yeah.
Yeah. Fantastic. Thank you for sharing that, because information is so important, especially if, for women in pregnancy. There's a lot of conflicting information floating around on the internet. We know
So,
that, right? Dr. Google is, and so getting based information is so important for our families. And that's why it is good to have a blog like yours. And what I really liked is when you said you non-traditional. You're quite a change maker there, not wearing a coat, a white coat. Do you find that you're more accessible for, approachable also, that women and families are opening up more to you because you're not, that doctor with the coat and coming in like that? Do you find that as well?
I do. I do find that it makes patients feel a lot more comfortable. But I think that a lot of, the reasons that women are uncomfortable with sometimes different providers is the provider's uncomfortableness with certain subject matter. So I feel like, the more kind of safe and natural and, kind of par for the course you can make topics, the more readily patients will be able to discuss and disclose, because people like to know that they're not the only one, or it's not nearly as big a deal as they think it is.
The kind of the reassurance that what they're
Yeah,
experiencing is quite normal, or can be quite
yeah,
normal as well, and helps them with their worries and concerns there as well.
exactly.
and opening up and discussing them, feeling free that they can do that there as well. Women's health, a great topic here. Women's, not just, for our pregnant women here and families, but also in general. You mentioned empowerment, and I would like to hear a little bit more about that. How do you empower women in that field?
So this is not like a woman's cartoon, but and this is actually going to date me a little bit age-wise. There used to be a cartoon called G.I. Joe, and at the end of that show, they always ended it by saying, "Knowing is half the battle." And I've kind of taken that to heart. You know, I actually today on my Instagram just did a video and a post on breast cancer. And, since obviously October is Breast Cancer Awareness Month, and just giving very simple, relatable facts about screening, wellness, breast awareness, etc. So knowing is half the battle. When you know, you can do better.
Yes. Absolutely. Absolutely. It's a very important point. Yeah. Knowing, and then you can do better, and having it in digestible form in a
Yeah,
way that people understand it, that they feel like it's not just like, oh, it's medical lingo here,
right,
and
right, right.
something abstract, but something they can relate to, that they can digest and use, if it's like
So,
the self exam, or what is screening, explained it in a way that they can
right.
understand and relate to it as well. That's wonderful. Let's talk about the presentation, and your presentation title. That it sounds absolutely fabulous to me. Creating wellness in pregnancy, how to affect the best outcome. Tell us a little bit what that means. What is wellness? Wellness is a word that floats around a lot right now, right? It's
It
almost like
is.
this a new kind of, has been for a while, maybe a kind of fashionable word to say. But with regards to the topic here, pregnancy, what does that mean for you?
For me, wellness means, being in a position to be at your best. But the
Hmm.
one thing that I want to remind people of, wellness isn't just about physical. It's also about mental, emotional. It's the entire person.
Hmm.
Not just, with a focus on, the pregnancy, but there are so many dynamics that go into pregnancy, all the emotional lability, the stress, not only physical stress on the body, but, mental stress, specifically if it's not your first pregnancy and you're a mom that has other kids and you're running a
Yeah.
household. One of the things that I feel like in obstetrics, sometimes we don't focus on the whole mom, and the
Hmm.
whole mom needs to be taken care of.
Yeah.
Not just the pregnancy, but all the other stresses that go along with the pregnancy. That's a huge piece of
Hmm.
wellness.
Absolutely, absolutely. And you mentioned an important point that it's not just the physical, it's also, the whole person, the emotional, the stress.
Yes,
We're learning a lot about perinatal natal mood disorders and anxiety disorders there.
yes,
Before it was okay, postpartum depression, but now we're learning so much more that, these depressions, anxieties,
yes,
and can occur during pregnancy as well. So, as clinicians and practitioners, we need to be on the lookout for that early on as
yeah.
well.
And giving moms a safe space to be able to admit that pregnancy is hard. It can be hard.
Yeah, that is a very good point, because also in the media and what we see on images, it's always this kind of the woman, in the dream, like,
Yeah,
looking, holding her belly, but it's never addressed that, yeah, pregnancy is, yes, even if you look forward to this, even if it was
yeah,
a planned pregnancy, but it's not always easy physically or
yes,
emotionally, right? And I think you made a good point there. If women feel like, yes, they're heard, their feelings are validated, their concerns are validated, and they can talk about that and being taken
sure.
seriously, that's an important point there as well. And before I let you go, Dr. Jones, I know you also have a book on Amazon. Can you just briefly tell us about that one as well?
of course, my book is, and I think this is,
Oh,
my apologies for that. My book is called What to Expect During Pregnancy and Beyond, and you can find it on Amazon. I also wanted to tell you that my website has everything,
oh, good. Mhm.
www.askdrangela.com,
Perfect.
AskDrangela.com. But really, my pregnancy book is a compilation of the most frequent questions that I get throughout the course of a pregnancy. And it's actually in relatable terms. You know,
Great.
just like I'm talking to you is
Hmm.
exactly how I speak to my patients.
Great.
You know,
Wonderful.
relatable, easy to understand. It goes from trimester to trimester. And it's not a long book, but it's a very concise book on
Hmm.
what to expect, not only from trimester to trimester, but also post pregnancy as well.
Important topic there as well, because postpartum is also not an easy time sometimes, so it's good to
Yes,
also address that there. Well, great. Well, thank you so much, Dr. Angela Jones. It has been a pleasure talking to you. Thank you so much for your time, and we appreciate it. I know the phone was ringing, and as we know, babies can't wait. So thank you so much for spending time here with us, and we're looking forward to your presentation.
Kristen, thank you so much for the opportunity. Really appreciate it, like beyond. And
Thank
just be well and be
you.
happy and be safe.
Be well as well and be safe as well. Thank you so much. And for our viewers, if you would like to find out more about Dr. Angela Jones and the presentation, you can visit www.goldobstetrics.com, and there you will also find information about the other presentations of the conference. And again, the conference will start November 9th, and I hope to see you there. Thank you and goodbye, everyone.